Our plan is to do all we can to beat the worst models or the worst case scenario and to reduce the case number and the hospitalization rate. And I wanted to show a graph today that was prepared by our public health experts at the Department of Health, led by Dr. Smith. And as you can see, and this is Arkansas, and these are not hospitalizations, but these are cases. And you can see that these are actual numbers from where we started with 0 on the cases going through the current time frame, March 25th, and it increases, and then under the models, you have a more significant increase, and this modeling takes us into mid-April. And during that time frame, as you can see, we'll go from our current number of cases, which today is 381, that we could go to 2,000 cases by the first week in April, and we could be in 2 weeks to 3,500 cases in Arkansas. Now, this is modeling that's based upon what's happened in other states, what the experts tell us. It doesn't mean it's going to happen in Arkansas, but those are the kinds of projections that we're trying to anticipate, and we're sharing that story with you. Now, that's not hospitalizations, and if you looked even at a 20% hospitalization rate, and if you have 3,500 in 2 weeks, that's 700 cases that are hospitalized in our state. That means as you go further down the line, and we don't know, the peak could be anywhere from April 25th to June 1st on this modeling. And if that modeling is correct, then that trend line will continue to come up. The cases and hospitalization will go up. My goal is to beat those numbers. And that's what we're trying to do as a state, to beat the modeling, that trend curve. And at the same time, we want to do everything we can to beat that modeling. We also want to prepare for the worst case scenario.
I want to briefly talk about some of our work. As the governor has mentioned, we're looking at projections and models. There's a wide range out there in terms of where we're going to be in a month or two. The numbers that he showed, our graph is trying to project out a couple of weeks using what we know about the curve of infectious diseases, communicable diseases, and using a computer algorithm to find a best fit for that curve. The further out you try and project, the less accurate it becomes. But this gives us a sense of where we might be in 2 weeks, and also helps us to decide what we need to do now to put ourselves in a better position for the near future.